Back with us is Dr. David Klein of the Stages of Life Medical Institute in Longwood, available to you by either driving up there or maybe you can go online to stagesoflife.net. Now, not .com, let's make that clear. .net. Last week I had several people say to me, I can't find stagesoflife.com. I said, no, it's .net. Let's think about that. Okay, it's getting spring. Everybody's outside. Very active population up in here, whether it's Spruce Creek, Mount Dora, it doesn't matter. Everybody's getting outside across the south. It's really nice, and you're running into some pain. Or maybe you've got pain all the time. Maybe you think you've got neuropathy. Maybe you don't know why you have pain. Well, every kind of pain has crossed the doctor's desk, and we're going to take some time right now, and we're going to talk about constant pain, or maybe just pain that pops up when you move a certain way, you try to get out of bed, you try to get out of your car, and we're going to talk about that. Pain. Everybody hates that, doctor.
Well, pain is the number one symptom that will bring any particular person to a doctor's office for medical attention. So it's either going to be backache or headache, could be some type of peripheral nerve type issue, but pain is what it is. Now, I've been treating patients with pain for over 35 years. I opened the first office-based pain center in the United States.
Wow.
Okay, there were 50 altogether in the early 80s, all university-based, except for mine, which was, in a small town. Well, what does that mean? Well, it means I've been around long enough to see over 60,000 patients complaining of pain, and you get good at things with enough practice. Okay, and here's the issue. Okay, more times than not, patients will come in with pain that's misidentified. And I used to say, and I still do, I suppose, that the most common of all diagnoses that presents to me is misdiagnosis. Well, what does that mean? It means that they didn't have what was advertised. You have backache, or maybe you don't. Had a gal come in this past Thursday with backache. She was convinced it was the disc that was narrowing in. It's bone on bone, which is one of the dumbest things anybody can ever say. It's bone on bone in my back, therefore it hurts. Well, no, when things are bone on bone, the nerves that surround the bone are gone. It's one of the least painful things going. If you fuse a joint, it doesn't hurt anymore. No, what hurts is actually it's generally the tissue around it. But in this case, nobody bothered to look at her knee. And what was happening is she developed an arthritis of her left knee, causing pain in the left flank. It's called referred pain, very, very common. Groin pain, flank pain, look at the knee.
Interesting.
Very, very cool. Somebody comes in with neck pain, hand pain, look at the elbow. It's very, very common. You see this in animals, in particular horses. When you only treat humans, it's a real problem because you never see these things. When you treat creatures of all species, then pretty soon you start to learn this stuff. And I had to do this for my daughter's horse. Okay, otherwise you're spending a fortune on these vets. You really have to learn how to do it yourself these days. So in any event, what are we looking at? And the purpose of this little discussion was going to be, how do you get yourself into trouble with pain pills? Well, the obvious is, you become addicted to it. Nonsense. Very, very few people that actually experience pain at all become addicted or habituated to them. But what does happen, which is very, very common, in fact it happens almost every time, is they develop sleep disorders. Opiates, narcotics will cause sleep disorders 100% of the time after a month or so. Why does this happen? Because the opiates inhibit the secretion of two hormones, one of which influences the adrenal glands, and insufficient adrenal function leads to what's called mid-insomnia. You wake up in the middle of the night, can't get back to bed, or the inability to get to sleep due to melatonin secretion. So guess what? Most of these pill jocks, and the pill jocks could be family docs, they could be any other variety of miscreant, where they're out there throwing pain pills out there, causing people to develop sleep disorder, which in turn causes depression, which in turn causes all manners of biochemical changes, sometimes known as adrenal fatigue. Why? Well, you don't really have to function. When does this happen? After 6 weeks or less. What else do the pain pills do? Almost without variance. They cause constipation. So you can either go ahead and wait for somebody else to come in and flush you out, or you treat the constipation before it occurs, try to keep ahead of it, and then it isn't much of an issue. So out in the villages, okay, my guess is about half of the people out there either have insomnia caused by this or constipation caused by this, or both. Because just about everybody that walks into my door taking a pain pill for longer than 4 weeks has the exact issue. So what do? Well, the first thing you need to understand is that pain isn't caused by one chemical. It's not one chemical at all. It's actually a variety of chemicals by a variety of pathways through a number of different tissues, contributing to a complex pattern resulting in impairment. So, pain is one thing, but impairment is really what we're talking about. If you have an ache, pain, or whatever that doesn't cause you any dysfunction, you don't really care. Okay, but as soon as it influences your golf game, your tennis game, your ability to sleep at night, or perform certain actions with significant others, you don't really care. So what are we talking about? Well, the number one modulator of pain is actually GABA. It's a neurotransmitter that gets disrupted very, very quickly in nerve and muscle tissue. So the most important and the hallmark of pain treatment is starting off with what are called GABA agonists. In the absence of this, the opiates do not work. Well, where else do we work? Serotonergics. Okay, these are important. Sometimes they're known as antidepressants, but they're not typically used in high enough dosage to cause, to treat depression. So you need to deal with these things in combination. When you're looking at things, well, gee, I need a pain pill, you are destined to fail. You have got to fail. It happens every time, and it's treatable. Well, what about injections and steroids? Well, I've done over 300,000 peripheral nerve blocks and epidurals. The epidurals really don't work. Okay, you take them once, you take them twice, you get temporary relief, which, by the way, is no different than the relief you get when you take the steroids orally. And then you shut the adrenals down from the use of the steroids epidurally.
Right.
The peripheral nerve blocks are a little bit more sensible if used in modest dosage and used on an as necessary basis, rather than this typical, gee, let's do you 3 times, and if that doesn't work, we're going to send you to surgery. Why waste your time? Just go to surgery, end up a statistic, and then we'll deal with you later. What about the muscle relaxants? Very, very important. Why? Because muscular pain, you're 70% muscle after all. How
Right.
much nerve? Less than 5%. What do you think is going to get injured, the nerve or the muscle? It's the muscle more times than not. So you have to use the muscle relaxants effectively. So muscle relaxants. What about anti-inflammatories? My God, your bone is attached to each other by these little ligaments. When they get disrupted, they become inflamed. When they become inflamed, they hurt. But how many different modulators of inflammation are there? Over 100.
Oh, wow.
So you have to be very, very systematic in the use of these medications. They're used in combination cocktails. It's essentially a medical 10-bean soup. How many beans does it take to make a 10-bean soup?
I'd say 10.
Yeah, certainly more than 1, certainly more than 2. So you got to get in there and work with your doctor on this. This has been a chore of mine for 35 years. I have 3 board certifications in pain. It aggravates me beyond words to see what's going on out there right now.
We have about a minute and a half, maybe 2 minutes, to talk about the fact that we get so many calls on our Orlando show that people will call you and say, Dr. Klein, I know I have neuropathy because I'm in so much pain and I am diabetic, and boy, do you shoot back in a nice way.
Well, I try to be nice. Try hard. Yeah. Well, what happens is people they assume that because their feet hurt, they have diabetic neuropathy. And the joke is, many of these folks don't even have diabetes. The hallmark of diabetic neuropathy is that you walk around on blocks of wood. Your feet get numb first. The pain follows much, much later.
Yes.
If you don't go through that phase, the likelihood of it being diabetic polyneuropathy is very, very small. But people develop enthesopathies. These are disorders of fibromuscular and tendinous attachment, and they're very, very common causes of foot pain, typically, again, behind the knee. So individuals that wake up with foot pain, they have foot pain towards the end of the day, their calves hurt, the likelihood of this being diabetic neuropathy is about 0. Diabetic neuropathy is constant, it never goes away and progressively gets worse. The enthesopathies come and go, and that's more common than not.
And the first thing you always say on the air is, let's do a nerve conduction study and let's find out what's really wrong.
The nerve conduction study is very simple. It takes about 25, maybe 30 minutes to perform, and either it's there or it's not. And 9 times out of 10, it isn't. People may end up with a small neuropathy due to their shoes. We see that a lot, boots and so on and so forth. Here in Florida, we see it a lot. But that's not the same thing as sural, that's spelled S-U-R-A-L neuropathy, or tibial neuropathy, which is a hallmark of diabetic polyneuropathy.
Okay, and Robin, you have 15 seconds to how do we get a hold of you?
You give us a call at 407-679-3337 or get on the web at www.stagesoflife.net. Stages of Life.